Hello, friends. I'm Dr. Harvinder Singh, and today we will discuss the role of ANK3, which is ankyrin 3 gene in bipolar disorder. And this video section is actually done by Dr. Samuel Sharmat. He is the practicing psychiatrist in New York City. And this presentation, 5-minute presentation, is actually a section from our most recently released conference, which is Bipolar Disorder Update 2020. So Dr. Samuel Sharmat will actually talk about this whole topic of utilizing pharmacogenomic testing in treating bipolar disorder. Well, you all must have read about using pharmacogenomic testing in major depressive disorder, but this topic is very unique because Dr. Sharmat will talk more in line of bipolar disorder. And in this short section, he will discuss the role of ANK3 gene in bipolar disorder. I want to thank Dr. Sharmat again and have him discuss this topic now. If you're interested in learning more about the conference, do listen to my brief talk at the end of this presentation. Thank you again.
Okay, so you've got your genetic results, and now we want to apply them both to diagnosis and to treatment. Let's take a look at those two genes that I was talking about and learn a little more about them. So the two genes that you're going to see on some of the panels are ANK3 and CAC-NA1C. ANK3 codes for the production of something called ankyrin G, and ankyrin G is responsible for putting sodium channels at certain places along the neuron, both by the axon hillock, as it's called, and also at the nodes of Ranvier for the neuro folks out there who remember your neurophysiology. So when ANK3 isn't coded properly, there ends up being a problem with the sodium channels. And that's been the understanding up until now. There's actually some new information starting to come out too that I'll get to in a minute. But let's go back to this idea of the sodium channel. In terms of bipolar disorder, for a long time we've known that Depakote is a solid treatment. It's actually tied for first place with lithium as the gold standard treatment for bipolar disorder. And what does Depakote do? Well, Depakote, or divalproex, affects how the sodium channel works in the neuron. So there's something sort of elegant about having a gene that's affecting the sodium channel system and then having a medication that treats that problem. They sort of go together. So when you do your testing and someone comes up positive for an ANK3 variation, what you might want to think about is using Depakote. This is something I've done in my practice multiple times. And since I'm testing everybody, I'm seeing results come up even when there isn't a full bipolar diagnosis, but there are some subthreshold symptoms. For example, something I see a lot in people who have an ANK3 variation is a difficulty with anger or temper. And for those patients, even if they don't have bipolar disorder, a very small dose of divalproex, as low as 125 milligrams a day, or in some patients even every other day, just to get a very low blood level in the background, makes a huge difference. Now, some of you may say that you don't need a genetic test to know that. It's true. Depakote or divalproex is one of the go-to medications for people who have either an intermittent explosive disorder or a lot of difficulties with anger or temper. So one could just try the medication without doing the genetic test, and that's 100% true. It's also nice when you've done a genetic test to have that black and white evidence in front of you for some patients who may be resistant to taking a medication, to the idea of taking a medication, and having the report in front of you makes it a little easier to say, why don't we try just a little bit of this and see if that can help calm the system down a little bit. And it does. What I wanted to add about the ANK3 system is that there's some new information coming out as well, that ANK3 and ankyrin G may affect how a substance called kinesin, you don't have to get into this in too much detail like I have, but there's a substance in the neuron and that moves things inside the cytoplasm, and that is sensitive to lithium. And so it's starting to look like having a positive ANK3 variation may also indicate that someone would be a good responder to lithium. Now, there are other articles looking at other genes for lithium responsiveness, but if you're just looking at the basic science and what the gene is coding for, it would make sense to do some trials of lithium in those types of patients, as long as they can tolerate it, of course, and don't have any other contraindications to taking it. So that's the story for ANK3. I can tell you in my experience, I haven't seen that many patients with the ANK3 variation. It's not as common as the CA-CNA1C variation, but it definitely does come up here and there. And when it does, very often I'll add in a little bit of divalproex to help treat it. And I see people having a better sense of well-being, and they prefer to stay on the medicine rather than come off it, even though some of them will come off of it just as a trial and then go back onto it to see how that feels. Usually they prefer to stay on it. And at the low dose, it doesn't cause side effects. Of course, with a more flagrant severe bipolar 1, you'd want to use higher doses, of course. These genetic tests never tell you what dose of medication to use. They're always just trying to shine a little more light on the underlying processes, either of what's happening in the brain or what's happening in the metabolic system. So that's ANK3.
Watching this short video by Dr. Sharmat. In this short discussion in the end, I will explain more about this conference. So Bipolar Disorder Update 2020 was released more recently on December 15th. But the unique thing about this conference is that this is an online conference and you can start anytime, end anytime, and you will have access to this conference for lifetime. I will put the link below how to read all about all this, but let me very quickly go down and show you the lectures that we have in this one. So these are divided into 4 sections. As you can see, we have lectures on the treatment update by Dr. Yatham. He will talk about bipolar depression, and then I will talk about bipolar mixed specifier. And then we have Dr. Selvaraj. He will talk about treatment-resistant bipolar disorder. In the second section, we have bipolar disorder in special population, where Dr. Friedman will talk about bipolar in pregnancy and postpartum, and Dr. Gupta will talk about bipolar in the elderly management. The third section is managing mood stabilizer adverse event, where Dr. Carr will talk about managing rashes associated with mood stabilizers, and I will talk about managing lithium's adverse event. And then the last section is managing bipolar beyond psychopharmacology. And you just saw a very 5-minute section done by Dr. Sharmat on utilizing pharmacogenomic testing in bipolar disorder. Then we have Dr. Massamer. He will talk about impact of cannabis on bipolar disorder. And the last topic is by Dr. Masood. She will talk about the biased psychiatrist. So friends, if you're interested in learning more, do click on the link below and do not hesitate in contacting me if you have any question. All the information is on the main page of the conference. So friends, thanks again for listening to this video. You all have a good day. Bye for now.